Good afternoon, everybody. We will start lectures about clinical pharmacy part 2 for the fourth stage students of clinical of the College of the Pharmacy. And the reference for this lecture include the clinical pharmacy and therapeutic, applied therapeutic, pharmacotherapy handbook, and pharmacotherapy principle and practice, as in the pictures. All are the last edition available on net. This is the syllabus for this semester. Our lecture today is about the hypertension that is defined and persists elevated arterial blood pressure, and they can be the stages of hypertension can be classified for adult patient: abnormal, pre-hypertension, stage 1 and stage 2. According to systolic or diastolic, for normal patient should have blood pressure less than 180, 20, sorry, over 80 for diastolic. Pre-hypertension stage when the blood pressure less than 140 but more than or equal to 180 for systolic. Stage 1 hypertension when the blood pressure elevates more than or equal to 140 and less than 160 for systolic, or 90 to 19 for diastolic. Stage 2 hypertension is when greater than 180, 160 over 180. Sometimes there is other term isolated systolic hypertension when the diastolic blood pressure less than 90, but the systolic blood pressure more than 140 is called isolated systolic. Hypertension crisis is a situation when there is blood pressure uh, greater than 180 over 120 meter mercury, as either could be classified as emergency or which is extreme blood pressure elevation with acute progressive organ damage, or hypertension in urgency blood pressure elevation without progression in the organ. The pathophysiology: all the pathophysiological mechanisms act through two primary determinants of the blood pressure. Two determinants of blood pressure available, which is that control blood pressure of the body, either cardiac output or the peripheral vascular system. All the pathological mechanisms affect either the cardiac output or peripheral vascular system or the tone of the vessel. More than 90% of the cases of hypertension is idiopathic or called a primary or essential hypertension. Less than 90% is secondary hypertension or due to the known cause. Probability of premature death due to the hypertension is related to the severity of blood pressure elevation. As the more severe blood pressure elevated, more the risk for the development of end organ damage and the early or premature death. Main cause of the death include the stroke, cerebrovascular events due to severe elevated hypertension, cardiovascular events like MI, angina, and then renal damage due to renal failure. Secondary causes for hypertension include chronic kidney disease, Cushing syndrome, coarctation of aorta, obstructive sleep apnea, hyperthyroidism, pheochromocytoma endocrine, hyperaldosteronism, hyperthyroidism. Drugs like corticosteroid, estrogen, non-steroidal amphetamines, butyramine, cyclosporine, tacrolimus, erythropoietin, and vildagliptin. Mechanism may involve in the primary mechanism. These the mechanisms that involve in the primary hypertension include the humoral abnormality that involve or humoral or hormonal abnormality that includes changes in the renin-angiotensin aldosterone system or natriuretic hormone, disturbances in the CNS like uh, atomic nerve fiber abnormality, adrenergic receptor or VAR receptor abnormality, excessive stimulation of adrenergic system, abnormality in the renal tissue or autoregulatory process like that defect in the sodium excretion, plasma volume, or and arterial construction. Or another mechanism includes deficiency in the synthesis and vasodilator substance like like prostacyclin, bradykinin, and nitric oxide. oxide. Excessive vasoconstriction substance released like angiotensin 2 and endothelin. High sodium intake or low dietary calcium may cause elevation in the blood pressure. All these mechanisms are postulated and no one is fixed. Some patients may have multiple mechanisms that induce a primary hypertension. The genesis factor. Clinically, the most commonly the patient with the primary hypertension in complicated case present as asymptomatic patient or sometimes is complaining from what from the headache. Other symptom other symptom may present if the patient had secondary cause like a chromocytoma in which there is a tachycardia, feeling of heat intolerance, aggressiveness, excessive sweating, cold extremities. Sometimes additional symptoms may develop if the blood pressure was inadequately controlled. Severely elevated blood pressure may lead to end organ damage like kidney damage, bleeding, retinal bleeding, nose bleeding, whatever the other causes symptoms. How we can diagnose the hypertension? Diagnosis of hypertension by, is by measurement of the blood pressure, ambulatory measurement by use of the blood pressure measurement devices, either in the office or in the home. In the office of the home. If I prefer in the office to for diagnosis, for diagnosis of blood pressure, the diagnosis should be based on average of two or more reading taken each of two or more clinical encounter. يعني لازم مريض نقيسه مرتين أو ثلاثة بمناسبات مختلفة حتى نشوف ضغط صاعد، يلا نعتبره إنه ضغط الصاعد فوق ال 140، يلا نعتبره هايبرتنشن. زين. اللابوراتوري تيست دائما من يجي دائما نسوي inspection for sign of end organ damage. عندنا retinal damage, brain damage, heart damage, kidney and peripheral symptoms. Laboratory tests like the measurement of electrolyte include potassium, sodium, and calcium. Blood urine nitrogen, creatinine, albumin, fasting lipid panel, fasting blood sugar, albumin creatinine ratio for estimation of kidney function or proteinuria, GFR by serum creatinine, and ECG. All could be used for determination of the stage of hypertension, severity of hypertension, and the possibility of end organ damage induced by the pressure. The other lab tests used for diagnosis of a secondary cause for chromocytoma may use measurement of plasma norepinephrine and urinary metanephrine level, or vanille mandelic acid. For primary aldosteronism, we can measure plasma and urinary aldosterone concentrate. Vascular renal vascular resistance, we can measure renin activity, captopril renin activity where the renin is highly elevated in case of renovascular or renal artery stenosis. Captopril stimulation test, renal vein renin, and renal artery angiography could be used for assessment of renovascular disease. Treatment. The goal of treatment is to reduce the morbidity and mortality by at least intrusive mean as possible. The goal of treatment is to reduce blood pressure less than 140/90 يعني أقل من 140/90 for most of the patient, including those patients with diabetes or chronic kidney disease. لا أقل من 100 بعد أقل من هذا المعدل يعني أقل من 140/90 أقل شوية بعد مثلا 120 على أو 115/70 أو 120/80 maybe used in the selected population like in the patient with the heart failure. The blood pressure may be reduced. Other goal reduce less than 150/90 for the patient that have age 80 and severely of the age extremity, 80 years old age or older, without diabetic or kidney disease. This table show the general clinical presentation and diagnosis of primary hypertension. General point we should focus on. For age, the prevalence of hypertension is likely to be highest in the middle age or older patient. Gender, in the United States, hypertension is slightly more in men than women before the 45 years old. Symptom, the primary hypertension may be asymptomatic. Most commonly patient is complaining from the headache. Uh, some patients maybe have another symptom according to the cardiovascular risk factor and organ damage. Signs, which is signs, all adult patients have average of 2 or more blood pressure reading on 2 separate occasions, according to the stages. Laboratory tests, lipid profile, like we should perform lipid profile, fasting blood glucose, okay, diagnosis of diabetes, uh, measurement of end organ damage, target organ measures. Treatment for primary, we should start with non-pharmacological treatment. Uh, these non-pharmacological may give a result similar to those therapy with a single antihypertension drug. This modification in the lifestyle modification or non-pharmacological treatment include weight reduction, a dog-eating plan, okay, dietary consume rich in fruit, vegetable diet, low-fat dietary product with reduced content of saturated or total fat. Dietary sodium restriction, uh, like physical activity increase, moderate alcohol consumption, all will reduce the blood pressure by about range from 2 to 90 millimeter mercury. But the more effects occur, especially for what for weight reduction and dietary changes. Pharmacological treatment, according to the uh, National Institute of Health and NIH system, which is the last updated guideline for the patient with the hypertension and diabetes mellitus. The step one, when the step one, we start with the ACE inhibitor or angiotensin II receptor blocker, and for the patient with hypertension, diabetes, or the patient have less than 55 years old and not black or African American. Okay, we can start with the ACE inhibitor or angiotensin receptor blocker. And the step two, we can add calcium channel blocker or thiazide diuretic. In the step three, we can start on ACE inhibitor or angiotensin II receptor blocker. For the patient older patient than 55 years old or black African American, starting with the calcium channel blocker, and then in the next step we can try use addition of ACE inhibitor, angiotensin or thiazide diuretic to calcium channel blocker. In the step 3, which is step 3, combination of medication will be taken like ACE inhibitor, angiotensin plus calcium channel blocker and thiazide diuretic. The monitoring for this patient should be performed in the office, especially for type 2 diabetes and symptom of the posterior hypertension for 8 years old patient. Target, if the patient not responsible for the combination of treatment, we should start confirm the resistant hypertension. We we may add low dose of spironolactone, low dose of spironolactone between 12.5 to 25 milligram per day. Alpha blocker or beta blocker with the vasodilatory effect may be used if the serum potassium greater than 4.5 milligram. Okay, this is a nice guideline for August 9, 2019. There is a key concept: patients that fail to achieve blood pressure control, even despite the good adherence, often dose of three or use of three medication of different class. One of them should be diuretic. The patient should be evaluated for secondary cause of hypertension. بمعنى آخر أي حالة من حالات resistant hypertension لازم نشيك secondary cause of hypertension. Selection of medication with the patient with the hypertension and the compelling indication. If the patient hypertension and have heart failure with a reduced ejection left ventricular heart failure, standard pharmacotherapy راح نستخدم diuretic لازم diuretic ACE inhibitor angiotensin II receptor blocker and then added beta blocker. آخر last or add on therapy ممكن نضيف aldosterone antagonist. فإذا جينا هارت فيلر راح نحول قلبه راح نضيف دايوريتك بعدين نضيف أي سي نقدر نضيف ريسبتر بعدين نضيف بيتا بلوكر ولا فاينالي نضيف الدوستيرون antagonist. Post myocardial infarction we should start with beta blocker to reduce mortality and then may add ACE inhibitor or angiotensin receptor blocker. Coronary artery disease, same as MI, we should start with a beta blocker to reduce mortality and reduce workload on the heart, and then ACE inhibitor or angiotensin II receptor blocker. Calcium channel blocker could be added. Thiazide diuretic could be added if the inadequate blood pressure control. For diabetes patients, for diabetes to reduce complication, ACE inhibitor and angiotensin receptor blocker, calcium channel blocker could be used, and thiazide and beta blocker as the third line. Chronic kidney disease, ACE inhibitor and angiotensin receptor blocker could be used to reduce the proteinuria and renal damage. Recurrent stroke attack, thiazide diuretic or any or thiazide with ACE inhibitor. Thiazide diuretic or thiazide with ACE inhibitor. The drug commonly used for treatment of hypertension. The first class is diuretic. The first type of diuretic is thiazide. Thiazide, many types of drug in this class include chlorothalidone, indapamide, hydrochlorothiazide, and metronidazole. Chlorothalidone is more potent than others and have more adequate blood pressure control. That can have very long duration. The side effect may be less. Side effects of this class includes hypokalemia, electrolyte imbalance, negative effect on glucose and lipid, and may cause hyperglycemia or hyperlipidemia. Generally, more thiazide more effective in the lower blood pressure than group diuretic. Uh, not first, they are not first line in the pregnancy, but may be used with a close monitoring of hypokalemia. We should always monitor electrolytes, especially potassium, and the abnormality in the lipid or hyperglycemia. We should use good caution with gout and suprarenal impairment. Contraindication hypersensitivity and anemia. For loop diuretic, bumetanide, furosemide, torsemide, ethanochromic acid, all are loop diuretic. The better one is bumetanide, torsemide if they have a good availability greater than furosemide. The side effects like diuretic include the hypokalemia and electrolyte imbalance. Contraindication include the hypersensitivity, monitor electrolyte, metabolic abnormality, dyslipidemia, and hyperglycemia. Should be used in caution the patient with the gout, same as thiazide, and contraindication hypersensitivity and anemia or acute renal failure. Potassium sparing diuretic include amiloride, trimethylene, and spironolactone, aldactone. For generally, they cause hyperkalemia, gynecomastia, especially for aldosterone antagonist, spironolactone. We should monitor electrolytes, especially the potassium. They are contraindicated the hypersensitive reaction, renal impairment. If clearly known is contraindicated as antihypertensive. السيركيلاتين إذا renal impairment لا قلب chronic kidney disease, bilirubin should not be used, or serum creatinine greater than 1.8, and there is indication of renal impairment. Bilirubin should not be used due to increase the risk of the hyperkalemia. In addition, men as well as type 2 diabetes with microalbuminuria also contraindicate the patient concomitantly receive strong cytochrome 3A4 inhibitor or serum potassium greater than 5. يعني البيشنت اللي عنده رينال بيرمنت تقيس عن طريق اللو كرياتين كينوز أقل من 50 أو السيرم كرياتين أقل 1.8 زين بسبب ريسك أوف هايبركاليميا. patient عنده type 2 diabetes related with microalbuminuria ما نستخدم aldosterone. Patient communicate receive strong cytochrome 3A4 and inhibitor ما نستخدم. Beta blocker cardioselective like atenolol, bisoprolol, metoprolol tartrate, metoprolol succinate. The side effect includes negative chronotropic and inotropic effect, include beta bradycardia, heart block, heart failure, dyspnea, bronchospasm, fatigue, and lethargy. Caution, especially if the heart rate, if the patient heart rate less than 60, should be using caution. Selective beta 1 agent is administered as higher dose when abrupt discontinuation may cause a rebound hypertension. They are may mask the sign symptom of hyperglycemia in the patient. They are contraindication in the hypersensory sinus node dysfunction or severe sinus bradycardia, heart block regulated down 30 degree, cardiogenic shock. ACE inhibitor. ACE inhibitor, a lot of drug with this class include benzapril, captopril, which is prototype, enalapril, fosapril, zinapril, amoxicillin, abril, quinapril, ramipril, tronadoprid. Okay. Major side effect: cough, hyperkalemia, renal insufficiency, and angioedema. Require monitor for serum potassium sometime and monitor renal function. Initial dose may be reduced in renal impairment or in elderly patient or the patient who are volume depleted. Using caution with the patient with baseline hyperkalemia. They are contraindicated pregnancy and bilateral renal artery stenosis or unilateral artery stenosis in solitary function kidney. Both comment are applied to all the comment in the ACE inhibitor same as applied to the angiotensin receptor blocker. They also cause hyperkalemia, renal function deterioration, angioedema, and hypertension. They include azilazartan, candesartan, abrozartan, irbesartan, losartan, olmesartan, temizartan, valsartan. Renin inhibitor like alisecrine cause hyperkalemia and hypertension. Using caution in patient severe renal impairment and to patient deteriorated renal artery stenosis, both by and unilateral renal artery stenosis. Contraindication to use in combination with ACE inhibitor or angiotensin receptor blocker. Central agent include methyl central alpha-2 agonists that reduce the release of vasopressor adrenaline, like methyl clonidine patch, guanidines. Okay. They may cause transient sedation initially, hepatotoxic effects, especially for methyl hemolytic anemia, especially for methyl peripheral edema methyl orthostatic hypotension for clonidine. They are first-line agent in the pregnancy for methyl Tolerance problem may occur within after 2-3 months after initiation and increase the dose requirement. They are contraindication, hypersensitive reaction, use of more inhibitor, especially for methyl hepatic disease, and pheochromocytoma. Alpha-1 blocker include doxazosine, prazosin, tirazosin. They vasodilate, reduce cardiovascular resistance, may reduce posture hypertension, tachycardia, palpitation. Okay. Orthostatic hypertension, which is mean the hypertension on stand. Diuretic vasodilator, direct vasodilator like isobutyl nitrate, hydralazine, and hydralazine minoxidil. They cause for edema and hypertrichosis for minoxidil, tachycardia, lupus erythematosus for hydrolyzing. Minoxidil with diuretic and beta glucagon mitigate the side effect. Contraindication: hypersensitive reaction, pheochromocytoma for minoxidil, increase intracranial pressure as sulfadinyl and hydrolyzing. يعني nitrate reducer may cause increase intracranial. Parasympathetic inhibitor like reserpine, they cause mental depression, orthostatic hypotension, nasal congestion, fluid retention, peripheral edema, diarrhea, and increase in the gastric secretion. The contraindication: peptic ulcer, disease of ulcerative colitis, history of mental depression. This table shows the drug could use for compelling indication. In the case of the heart failure with reduced ejection fraction, يعني إذا صعدنا في طبعا اللي قدام according to the guidelines نستخدم diuretic, aldosterone antagonist could be used, beta blocker could be used with heart failure, ACE inhibitor ممكن نضيف angiotensin receptor, direct vasodilator ممكن نضيف. زين. البوست ام اي ورا الام اي طبعا drug of choice هو بيتا بلوكر، ممكن نضيف aldosterone antagonist prophylaxis ACE inhibitor بعدين. high coronary disease risk high coronary disease risk coronary disease نفضل بيتا بلوكر، كالسيوم شانل بلوكر حتى نقلل كارديك ووتر لود، فازيلتر ايس انهبيتر، دايوريتك ممكن نضيفه لاكتازا diabetic patient هنا diabetic ثيازا diuretic beta blocker could be used, calcium sorry so sometimes some patients need to associate stop the use of hypertension for a while or the major causes for inadequate blood pressure control despite antihypertensive pharmacotherapy include inadequate blood pressure control, non-adherence, inadequate hypertension dose, or inappropriate antihypertensive drug combination, or inadequate diuretic therapy, or secondary induced causes, or clinician failure to intensify or augment the therapy. Other conditions which relate to the lifestyle, like volume overload, excessive sodium intake, volume retention from chronic kidney disease, secondary disease, obesity, excessive alcohol intake. Other causes include improper blood pressure measurement, resistant hypertension, white coat hypertension, and pseudohypertension. White coat hypertension means that patient may may uh, may get a rise blood pressure on when visit the office for measurement of blood pressure due to the fear from the white coat or the medical staff. In this case, we should depend on the self-monitoring by blood pressure by electronic device. Sometimes we need to, as we said, cessation of antihypertensive pharmacotherapy. Like for thiazide diuretic, the cause for thiazide to stop is anuria and kidney failure. In the case of hypercalcemia and azotemia, or sulfonamide allergy, bone marrow depression, lithium intoxicity, and lithium therapy. Loop diuretic, cause of stop هو hyponatremia, hypocalcemia, azotemia, and anuria, photosensitivity. ACE inhibitor, angioedema, severe hyperkalemia, serum creatinine, increase in serum creatinine greater than by 1/3 or 35%. Glycogen in the bilateral artery stenosis, volume depression, hyponatremia. Angiotensin like ACE inhibitor. Calcium channel blocker اللي هو dihydropyridine like nifedipine group, significant peripheral edema, and the glycogen left ventricular dysfunction not special for nifedipine. Non-dihydropyridine like verapamil, heart block, and left ventricular dysfunction. Beta blocker maybe to bradycardia, left ventricular dysfunction, bronchospasm in the patient with the co-op. Okay. In the case of severe asthma attack, second or third degree heart block should be stopped. Okay. Coronary artery disease for agent with aldosterone antagonists, hyperkalemia, kidney failure. Treatment for another case of hypertension that include urgency and emergency. Urgency and emergency. If it is elevation of the blood pressure over 100 over 180 على 120. If there is an end organ damage, it's called emergency. While if there is no end organ damage or damage in acute damage in the organ, is called urgency. So urgency emergency same, they are same, but there is different only in the end organ. يعني يجينا مثلا مريض عنده elevated blood pressure 180 على 20 بس يشتكي مثلا عنده optical bleeding, nasal bleeding, hematuria, severe chest pain or MI, معناها هاي يسمونها emergency. اللي ما عنده symptom بس فقط complain from the hypertension like the severe headache with the severe hypertension ماكو risk factor يسمونه هذا urgency. بحالة الurgency التريتمنت هنا يكون within hour to days، بينما بحالة الامرجنسي لازم يكون fast within hours. اوكي. بحالة الارجنسي راح نستخدم short acting oral agents like captopril or labetalol بعدين with careful morning observation of several hours to ensure gradual blood pressure reduction in protection. Drug use oral captopril dose 25 to 50 milligram given 1 to hour interval. The onset with 15 minutes. Clonidine 0.2 is given initially, but then 0.2 hourly until the blood pressure, diastolic blood pressure below 120. Or sometimes use the total dose 0.7 milligram administered as single. Labetalol can be given dose to 200 to 400 milligram followed by additional dose every 2 to 3 4 hours to reduce blood pressure. In the emergency blood pressure, it is required immediate treatment due to the end organ damage. The goal was to reduce blood pressure not less than 140 over 90. Initial target blood pressure هو initial target إنه نقلل الضغط حوالي 25% from the initial within 1 hour within 1 hour زين. بعدين if the patient stable راح نقلله reduce toward 160 إلى IV إلى over 80 in the next 6 hours. زين. Avoid rapid decrease in the blood pressure because it cause end organ damage or ischemia and infarction. If the blood pressure is well tolerated, additional gradual decrease at the time after 24 hours. بمعنى آخر يعني emergency hypertension هذا يكون severe end organ damage يحتاج rapid treatment acute treatment تتضمن راح حتى نحصل acute treatment أو rapid decline in the blood pressure نستخدم IV agent أو fast agent. بحالة الاي في ايجنت لازم راح ننزل البلد بريشر على 3 مراحل. المرحلة الأولى ننزل 25% من القيمة الأولانية يعني قريب ال 160 إلى 110 ننطي عن طريق اي في ايجنت. بعدين نسوي له مونيتورنج تو ابوت فيو إذا patient ستيبل راح ننزله أكثر نقلل جو 160 على 100 أو جو 160 على 110. إذا نشوف patient ستيبل ممكن نقلل بعد لحد ما خلال الساعات التالية إلى الأيام التالية حتى ما ينزل الضغط gradually. ما يفضل ننزل الضغط بصورة سريعة لأن راح يسوي لنا peripheral ischemia or infarction. The drug of choice for treatment of the emergency hypertension هو النيتروبروسايد اللي هو direct vasodilatory agent. يستخدم ليش يفضل عن شكل انفيوجن حتى نسيطر to manage control of blood pressure. ما نقدر نستخدم أكثر من 72 ساعة لأن راح يسوي لنا ثايوسينات توكسيستي. فإذا شفنا ثايوسينات توكسيستي تعدت ال 12 لازم نوقف الانفيوجن. وما يفضل إعطاء إذا كان patient with the impairment kidney function. Drugs used for emergency hypertension يستخدم هو الفازوديليتري من drug of choice sodium nitroprusside النيكاردين، الفينولودوبام، الفينول فينولدوبام فينولدوبام. اوكي. النيتروجليسيرين انفيوجن انالبريت اللي هو ايس انهبيتر. هيدرالازين hydrolysine could be used uh, clividivine, diazoxide, and furosemide. طالما هو باز ديليتري ايجنت راح يسوون مشكلتهم شو راح يسوون؟ مشكلتهم راح يسوون فلاشين هيدك بوست ريهابيليتيشن فلاشين هيدك and tachycardia should be careful on uses. Another agent could be used beta blocker like inhibitors of an alpha and beta 2 receptor. Also injection 5 to 10 minutes. مشكلة مالته يسوي vomiting, scalp tingling, bronchoconstriction, nausea, heart flow. يستخدم حتى بالemergency case in the pregnancy. اسمه لون another beta blocker. يستخدم بالهايبرتنشن أو aortic dissection perioperative. الفينيتولامين اللي هو alpha 1 antagonist. rapid onset cause tachycardia flushing. Special indication بحالة كيت. Treatment of special population older patient اللي هو over 90. نعم بهاي الحالة ايش راح يفضل؟ أول شي بتستوعب بالبريشر أقل 150 على 90 أقل 150 على 90. هنا cardiovascular morbidity and morbidity closely related to systolic than to diastolic. زين. فيفضل هنا الأدوية يمكن استخدامها يمكن نذكر diuretic, ACE inhibitor, angiotensin provide significant benefit can be used safely in the elderly with a smaller than usual initial dose نستخدم. يعني إذا عندنا elderly patient drug of choice هنا راح نستخدم يفضل ACE inhibitor أو diuretic و ACE inhibitor خصوصا في diuretic. البلد بريشر راح يكون هنا أقل من 150 على 90. الدوز هنا راح يصير دائما أقل حتى avoid the side effect. Children adolescent دائما الhypertension in the children and adolescent most commonly is a secondary hypertension. So should be investigate for the causes of the hypertension to correct the underlying cause. Non-pharmacological treatments good for obese children. الدراج نفسه الأيس inhibitor angiotensin beta blocker calcium channel blocker or coexisting drug يمكن استخدامها في children and adolescents. ACE inhibitor the ACE inhibitor and angiotensin directly are contraindicated in the sexually active girls يعني لما راح تتزوج حتى بيسوي teratogenic. In the pregnancy ضغط البريجنسي أما يكون على شكل preeclampsia أو eclampsia acute أو ممكن chronic hypertension. Preeclampsia هو elevation of blood pressure over 140 over 90 with the proteinuria or sometimes associated with thrombocytopenia, impairment of the liver function, new development renal insufficiency, pulmonary edema. It could be lead to life-threatening complication اللي هي الإكلامسيا. الإكلامسيا هي عبارة عن convulsion in the preeclampsia is a medical emergency. Definitive treatment, final treatment for preeclampsia is delivery and is indicated if is bending or frank eclampsia. Management تتكون restriction activity يعني بحالة البريكلامسيا أو الضغط ارتفاع الضغط هي نقلل الأكتيفيتي ريد ريست close monitoring salt restriction اللي تقللنا الفوليوم should be avoided. anti hypertension ممكن استخدام prior to induction of labor إذا الدايستول blood pressure أكثر من 105. target الدايستول blood pressure لازم يكون من 95 ل 105. الدواء راح يستخدم أكثر شيء ال IV هيدرالازين most commonly used ال IV labetalol is also effective. إذا women pregnant وعندها chronic hypertension drug of choice يستخدم labetalol, nifedipine, sulfadoxine or sustained release method doses recommended as first line agent. beta blocker غير الأتينولون and calcium channel blocker could be used alternatively. ACE inhibitor, angiotensin, androgen are contraindicated in pregnancy due to the For patient African American, blood pressure or hypertension is more severe in the African American because they are characterized by low renin activity, low angiotensin receptor. So it's rational to use another treatment like calcium channel blocker and diuretic instead of ACE inhibitor and could be added in combination with the other drug to enhance antihypertensive activity. Third, patient pulmonary disease, uh, cardioselective beta blocker can be used safely, but the non-selective is not preferred. Okay, non-selective uh, is not preferred. For the patient with the peripheral artery disease, we consider which is non-coronary form of atherosclerotic vascular disease, beta blocker and with a alpha blocker could be used. Beta blocker generally not preferred. مع البيتا blocker with the alpha 2 antagonist with the carvedilol, labetalol ممكن استخدامه are more preferred than other beta blocker. Uh, beta blocker بسرعة may not contraindicate the bad because they have not been shown to adverse affect the working capacity. Otherwise, the drug could be used as alternative for treatment of blood pressure with the peripheral artery. This diagram shows division or classification of beta blocker agent can be classified selective and non-selective or and beta blocker positive effect. First, non-selective, either with negative intersympathetic activity like NADA or propranolol, timolol, or the patient have positive intrinsic sympathetic activity like pindolol, cartilol. Selective for either negative intersympathetic activity اتينولول ميتابرولول اسمولول بيتاكزولول بايسوبرولول هذول معادن فقط اللي سيلكتيف عنده بوزيتيف انترسمباثيك اكتيفيتي الايسيوتين بوزيتيف سمباثيك اكتيفيتي ما راح يقللون من الهارت ريت بصوره كبيره راح يقلل يعني يشتغلون بيتا بلوكر لكن ما يقلل الهارت ريت بصوره كبيره because they have some beta agonist activity some يعني partial agonist. Other agent هو beta blocker positive substance like carvedilol and alpha blocker labetalol and nabivolol that have a nitrate reducing activity. For evaluation of therapeutic outcome, we should first monitoring the blood pressure control. Monitoring blood pressure control performed every 2 to 4 weeks after initiating new therapy or changing the drug therapy. It could be used for about every 3 to 6 months if the patient was stable. It could be used more frequently if the patient has poorly controlled or no adherence or there is a progressive organ damage. The measurement of monitoring blood pressure should be performed by office measurement of blood pressure, except the white coat hypertension. The patient we will depend on reading of the self-monitoring by devices. The other evaluation is monitoring the adverse effect of drug. For new treatment, we should monitor the adverse effect of drug for about 4 weeks, every 2 to 4 weeks after starting new treatment. If the patient is stable for every 6 to 12 months. In case of adult aldosterone antagonists, we should assess a serum potassium concentration and kidney function 3 days to 1 week after the initiation of therapy to avoid hyperkalemia. That always we should assess the patient adherence to the therapy and asking the patient whether change happened to the quality of the life when the use of the therapy. He said 3 cases for patient encounter. You can read it and answer the question about it.